Hello everyone, welcome back to my YouTube channel. It's your favorite girl, Ewatomi. Um, please, if this is your first time, please subscribe and don't forget to click on the notification button so every time I upload a new video, you get notification. And thank you so much for your feedback from the last video. I really appreciate everyone. Love you all. And today, guess what? I have a guest. Here is my beautiful guest. Welcome to the show and thank you so much for coming. Please, can you introduce yourself?
Oh, thank you very much for having me. My name is Olivia. I'll just give you briefly my background. So, I've worked in the pharmaceutical industry for a number of years, over 15 years. I've worked in clinical pathology. So, I've worked with clinicians, educating them on various diseases, on how to treat patients, representing different companies.
Wow.
At the moment, I have my own company as well, a medical company. So I have a sort of background in working with clinicians. I'm not a clinician though. I just help them to guide them through when there's new innovations, new drugs, new technologies, how they can work with patients.
Oh,
but today I'm going to talk, I will be talking in my capacity as a patient, because as well as being someone who talks to clinicians, I'm also a patient like everyone else, and we'll be talking about smear tests. Yes. Pap smear. Some people still call it pap smear, but it's smear.
Yeah. Just a quick question. What is smear test?
Right, that's a very good question. So, smear test is basically a screening test. You'll go to your nurse. Usually in the UK, it's the nurses that do it, and they take a swab, basically of your cervix, so basically in your bits. They go into the opening of the womb and they just take a swab, so samples of the cells. And then they send it to the laboratory. They'll go and look at those cells under a microscope, basically to see if there's any abnormalities. That's what it is.
Okay.
So it's just a straightforward swab. They just do that, basically, or swab around there, yeah, with the little thing with the cotton wool. That's it.
Oh, okay.
So it's a screen test, so to see if you are at risk of having a cervical cancer or not.
Are they painful when you go for the test? Is it painful?
No. It's not a painful. It's just discomfort, a little discomfort, because they use a speculum just to open up a little bit and then swab. So it's not painful. It's just a little discomfort because they will need to open. That's it.
Okay. Just a quick one. You know, we have so many people that are not in UK.
Yeah.
So how often do you think they should go for the test? Like every 2 years or every 3 years, every 4 years? And what age as well? You know, is he from like 25 or like people need to know like what age?
Right. Wow. That's a very tricky one because different healthcare authorities, different governments, they recommend different ages, so they do it at different intervals. Mm-hmm. But here in the UK is from the age of, I think, from the age of 25 to 49, we have it every 3 years if all is okay. And then, so they start to see more regularly if you have abnormalities. So for example, if I had abnormalities, like I said, so they see me every year. And then I didn't have abnormalities for a while, then they started to see me every 3 years. Had abnormalities, now they want to see me 6 months. After the treatment, they want to see after 6 months, and then we'll take it from there. If everything is fine, they'll probably see me another year. But the regular interval for the UK is every 3 years for 25 to 49, and then between 50 and I don't know 50 to what age, then they see them every 5 years.
Okay.
Yeah? In terms of if you're not in the UK, what's the recommended? Truly, I mean, check your government's own recommendation. But if you're paying for your own healthcare, I would say go every year if you can.
Okay.
In the UK, it used to be every year. When I first arrived in this country, we used to do it every year. High risk or no high risk, it used to be every year. So obviously, there's too many of us. They have to change. They have to change. So if you can afford to do it every year, please have it every year.
Oh, okay.
It's better to know. Like I said before, I had a period where within a space of less than a year, I had abnormal cells, get them removed. Before a year lapse, I already had another abnormal cells,
wow.
say, and 3. So, but then again, I've been high risk. So you don't have to wait. If you can afford it to go regularly. But then once you've had abnormal cells here in the UK, then your clinicians don't discuss it with you, and then your own interval will vary according to your risk.
Okay. So is there symptoms to be before your test for the HPV 3? Do you see? Is there any symptoms basically?
So not necessarily, I wouldn't say for HPV. Remember, HPV, there's over 100 types of HPV, the viruses. But what we're looking out for is cervical changes in your cervix. So the sort of things that you might experience. Some people will have no symptoms at all. But some of the symptoms that you may have is bleeding. You may have bleeding or spotting between your periods, bleeding during or after sex. For those who are already in menopause, you start to bleed after you've stopped menopause. The sort of bleeding. So it's usually bleeding. For me, it was bleeding, and then it was also spotting. It was pain, a bit of discomfort. Yeah, it was a bit unusual pain, but it was that bleeding that was just the spotting.
Okay,
So
yeah,
I didn't have a regular cycle.
Oh, okay.
So
you still you still see some stains after period.
Or sometimes I'll have my periods and then have a few days of spotting, stop for 2 days, and then I have spotting again, something like that. So my cycle was just so irregular, and then I had to, because like I said, I check things, so I had to check with my GP, and then they send me. I had to get a coil so that I would not have periods at all. So hopefully I'll not have periods at all. But that still didn't work, and that's when I still noticed the difference, even when I held the coil, and I'm like, something else is not right here. So I went to request for some test, which came up positive.
Interesting.
Yeah.
So yeah, thank you so much for coming. Thank you, I really appreciate it, and I hope I will see you soon.
Hopefully.
You know, to.
I think next time we should talk about men's health. How about that? Talk about testing for prostate.
Yeah, we should do. Yeah, I don't mind. You know, you're welcome anytime. Thank you for teaching us new stuff. You know, and like she said, you know, we know our body. You know how you feel. You know if something is not normal. You know like she said, you know your body. You know, and the doctor can know you better than you know yourself. You know, so whatever information you give them is what they work on. You know, and that's when you get tested. And don't wait. Sometimes you don't wait for that later as well. If you feel like something is not normal, just go. It might be something else. Just make sure you see doctors regularly, as a woman and men as well. And remember, health is wealth. Thank you so much for watching this program. I really appreciate everybody. And please don't forget to subscribe. Thank you so much. Ciao, ciao.
Bye.